Back pain is very common. 80% of adults will suffer at some point during their lives with symptoms from their back. The back is a really complex structure, and back pain can be caused by problems with the joints, bones, or tissues around our spine, including the muscles which keep us upright and support our backs. In this video, I'm going to answer some common questions such as what is the difference between muscular and spinal pain? How do I know if my back pain is spinal? And what are some of the treatments available for spinal pain and how you may be able to manage your back pain at home? I'm Chris Brown, consultant orthopaedic spinal surgeon at Circle Reading Hospital, which is part of Circle Health Group, the largest independent healthcare provider in the UK, with hospitals right across the country. So, you may or you may not know whether your back pain is muscular in origin or spinal. If not, there are some differences in the type of pain you may be feeling that could help you and your doctor identify whether these are muscular back pains or spinal pain symptoms. If your back pain is in one place and only bothers you when you are in certain positions, then it could be muscular. Sometimes people know what has caused their problem, such as overdoing some gardening or lifting heavy objects. The pain will often be a dull ache, or you may feel tightness in your muscles. With spinal problems, you are more likely to feel symptoms such as a burning or an electrical type of pain if a nerve is involved. The back pain can shoot to other parts of your body, such as your legs or your glutes, and you may get other symptoms, although these are less common, such as incontinence and weakness in your limbs, or even groin pain. If this is the type of pain that you're feeling, it may be advisable to see a specialist, as you might require investigations, and in some cases, you might need treatment to help you get better. Okay, so this is a model of the spine, so let me use it to show you some of the common conditions that I treat. So something I see a lot are problems with the discs, where a piece of this disc material pushes out. That's called a slip disc or a prolapsed or herniated disc. That can push on one of these nerves which comes out of our spine to supply down into our legs, and that causes a condition which you might have heard of called sciatica. Something else that I see very commonly, and this often occurs as people get a little bit older, is narrowing or stenosis around the central part of the spinal canal. That can cause pressure on these nerves and again cause referred pain into the legs, or sometimes cause heaviness or even weakness. Some of the most common spinal problems I treat are slip discs, which are medically known as herniated or prolapsed discs. This condition develops where one of your vertebral discs moves out of place or bulges. Another common condition are compressed spinal nerves. This compression might be caused by a slip disc, less commonly a spinal injury, or by a much more common condition called spinal stenosis. Spinal stenosis is where the space in the centre of the spinal canal narrows. As a result of that narrowing, the nerves can become trapped in the spinal canal or where they leave your spine, and this can cause weakness, heaviness, or pain into your legs. You might have heard of the term sciatica. This is the term used to describe the pain down your leg, which is often caused by pressure on a nerve in your spine, perhaps due to a slip disc. Many cases of back pain can be effectively treated at home with postural changes, regular exercise, or by applying heat or ice and taking regular simple pain relief such as paracetamol or ibuprofen. Back surgery could be an option to treat any spinal problem if other treatments haven't worked, your pain is getting worse, or it's stopping you from living your life normally. One treatment for many spinal conditions is a steroid-based injection. This is often the first line of intervention. Surgery called discectomy, decompression, or even spinal fusion surgery can be used to treat problems with your spine that are making movement painful. If your doctor has confirmed your back pain diagnosis through a scan or an X-ray, and you'd like to explore treatment options beyond those that you can do at home, you could schedule a consultation with a spinal specialist so that you can learn more about the options you have to relieve your back pain. Talking to a surgeon doesn't mean you're committing to surgery. It's simply the chance to understand the various treatment options available to you. So, that was a rundown of common spinal problems and treatment options. If you're looking for more information on back pain or spinal conditions, if you want to come and see me for a consultation, for specialist advice, or to talk through any treatments covered in this video, you can book online via the link in the description below, or you can search for your nearest Circle Health Group hospital and the next available consultant in your area on circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, or you want us to make more videos on this or other conditions, please comment below this video, as we'd love to hear from you. Otherwise, thanks for watching.